Dr. Joanne Liu has worked around the world, helping treat people hurt in conflict zones and natural disasters, from earthquake survivors in Haiti to Somali refugees in Kenya. Liu has brought her experience as a pediatric emergency physician to those in desperate need. She has also just been elected president of the humanitarian organization Doctors Without Borders, a group with more than 30,000 staff working in 60 countries. And Dr. Joanne Liu is joining us this morning from Montreal. Doctor, congratulations to you.
Thank you. Good morning.
Good morning, and I understand that this is really the fulfillment of a lifelong dream. You read about a doctor working in a foreign country when you were a young girl. Here you are. Why did you want this position?
I think that it's a bit of a build-up of a journey with MSF, Doctors Without Borders. So I wanted this position because I think that at this point we are at a crossroad, and it's really important that somehow we remain focused on our patient in the field, and that MSF keeps a direct contact with the patient in insecure context, so working side by side beside our patient.
As we said in the introduction, you have done so much good work. You have been to so many countries that have seen disaster, so many conflict zones. But there must be some things you would like to see change as you become president. What changes do you think the organization can make under you?
Well, I do hope that through my mandate, we will be able to shed light on the fact that today medical care is under fire, meaning that often healthcare is being targeted, the physician, the healthcare structure, our patients. So this is one thing that I would like, that somehow around the world people get concerned about what's going on, and that we build a community of concern with respect to the international humanitarian law. This is one thing. The other thing is about the fact that I would like a better access for medicine and vaccine for the patient in the field. There are some real issue in terms of having drugs at an affordable price. And as I often say, if it's not an affordable solution, it's not a solution. So we are looking for prices for vaccine at a lower rate. We're looking for medicine for HIV and multi-drug resistant TB at a lower rate. We are looking for drugs for non-transmittable disease.
Is there one particular country or region that you think needs help more than others that you want to highlight?
I think there are many countries that need, I would say, to be on the radar of the world. We talk a lot about Syria, and I would say that right now the main issue about Syria is access for humanitarian aid organization towards the population. There's 5 million Syrian displaced in the country. There's 1.5 million refugees outside the country, and then we know right now that the security is it's very, very difficult, and people have problems to move around. So we have to scale up and increase the offer of aid. Other countries that need as well, some attention is the Democratic Republic of Congo and the ongoing civil war since the genocide of Rwanda. We have, this civil war, it claims, above 5 million lives. And I guess just to finish, Somalia is a forgotten as well conflict, where it's very difficult to work and to have our teams working and providing care to patients.
And Doctor, finally, on a slightly more personal level, you have seen so much devastation. How do you keep your spirits up as a doctor working in these regions?
Well, I think that it's not to keep up your spirit, but it's the fact that somehow it's to realize that it's different there, and then that we should not get used to death. And I always say that nowadays that's the indifference that kills patient in the field and different populations. So we have to break our indifference towards the suffering of people elsewhere, and we have to engage ourselves to do something to build a better world for our children.
Dr. Joanne Liu, thank you so much, and once again, congratulations to you and good luck with your new position.